Good morning. So, in the last part of the anti-hyperlipidemic drugs, because all till now we have seen about the lipid metabolism, we have seen the classification of the drug, we have seen the how the different drugs is acting. Now, in case of the therapeutic use, let's see about the therapeutic uses. Now, statin or HMG-CoA reductase inhibitor, these drugs are affecting into the lowering plasma cholesterol. In case of the all type of hyperlipidemia, in case of the any type of hyperlipidemia, they are the useful to reduce the plasma cholesterol. However, patients who have the homozygous for the familiar hypercholesterolemia and lack LDL receptor, therefore benefit is much less from the treatment of this drug. So those having the lack of HDL receptor, they may not get the benefit much. Next is niacin or the nicotinic acid. It is lowers the plasma level of the cholesterol as well as the triglyceride. And again, it is useful in the treatment of the familiar hyperlipidemias. It is also used to treat other forms of the hypercholesteremia, often combined with the other agents. So it can be given in combination with the other agent also. Fibrates. Fibrates are the drug used into the treatment of the triglyceremia. That means increased triglyceride level. It is useful to reduce to the fibrates. They are particularly useful for the treating type 3 hyperlipidemia, and which is that is intermediate density lipoprotein particles, that is the IDL particles accumulates. So that is in that condition also it will be helpful. And next is bile acid binding resin. Now bile acid binding resins are helpful for the treating type 2A and 2B hyperlipidemias. Cholestyramine can be also useful to relieve pruritus caused by the accumulation of the bile acid in patient of the biliary status. Now, Coleselvam is also indication for the type 2 diabetes due to its glucose lowering effect. So these are the some bile acid binding resins. Next is cholesterol absorption inhibitor. This particular drug, that is a thymide, selectively inhibit the absorption of the dietary and the biliary cholesterol. Already we have discussed into the small intestine, leading to the decrease into the delivery of the intestinal cholesterol to the liver. And it is found that it is this drug helpful to decrease the LDL cholesterol level approximately by 70%. And this is, you can say that mostly used as in combination with the statin, clear, in case of the statin intolerant patient. Next is also omega-3 fatty acid. These omega-3 fatty acids are essential fatty acids which are predominantly used for the triglyceride lowering. Essential fatty acids inhibit VLDL and triglyceride synthesis into the liver. So these are the different drugs are there, and these are the some of the reference through which you can go through the different books, the links, and you can say that it will be very easy to understand about this. So I think hope you have understand. We will discuss if you have any doubt.